Okay, guys, so after your lecture today with respiratory management, airway management, you should have already have been introduced to OPAs, and you guys have seen these in your bag. It's the kit of the various sized semicircle hard plastic shaped catheters. We're going to demonstrate to you first how to measure the OPA for the correct size.
Okay.
Use generally red.
So we're just gonna measure.
From the corner of his mouth, down along the angle of his jaw, to the tip of his earlobe. Okay? Right there. And that would be the appropriate size for this patient. When she inserts it, she's going to insert it either to the side or curved facing the roof of the mouth. Halfway down into the mouth. Once we hit about the halfway point, back in the soft palate of the patient's airway, we will start to rotate that OPA and shove it on down to his tooth line, right down there to his teeth. Okay? Now, it's kind of hard to see here on Ed, but this OPA goes all the way to the back of his airway, catches his tongue, and pulls his tongue up and away from the back of his throat. This will allow us to give him oxygen. He has a clear and open airway down the side, plus that is a hollow opening right there all the way down. It's like a tube. It's not a ET tube. This is a BLS airway. This is something that EMT basics can do. It's going to hold his tongue forward and up off away from his airway and keep his airway open so that we can ventilate him. You would not use this on any patient who has a gag reflex, obviously. So if your patient gags and sputters, you're going to pull this out immediately and be ready for suction. Okay? So that's how we put it in. Now, Aaron, you want to show us how to pull it out? Really easy. Yoink straight on out of his airway. Okay? Now I'm going to show you her putting it in without any of the narration so you can see how the skill is going to look like.